Aloha everyone, and welcome back to Aloha Jen's Beauty Blog. For those of you that are new here, hi! My name is Jen and I am a licensed esthetician in the state of California. Merry Christmas and happy holidays everyone. Today is Christmas Eve. I haven't been here for a bit. I know my schedule just got really crazy. And I was actually hoping to film yesterday, but I didn't get the chance to. So here we are today on Christmas Eve, a very special video. So I hope your holiday season has had a great start so far. I hope this holiday season brings you, joy, happiness, peace, and love. This is actually a pretty rough time of year for me. I won't get into details, but it is not my favorite time of year, but I try to make the most of it. This time last year, Molly was really sick, and it's so weird because Molly has been, heavily on my mind this week. And I heard a song on the radio the other day that reminded me of her, and I just broke out in tears. I miss her so much, and I should pop a picture up here because this morning when I was on Instagram, this memory popped up, and it just I'm like, so weird because I've been thinking about Molly so much. But it's really tough for me, right now. We do have little Miss Misha, which I'll show you. Come here, babies. Come here. So little Miss Misha has gotten pretty big here. If she lets me grab her. She's kind of squirrely. So here's the little Miss Misha Boo. Sorry, getting a belly shot. So Misha Boo is what has been my joy and happiness this year. She has brought me out of a dark place and a deep depression. And I just love this little baby so much. She is just so precious in every way. And she's actually on a diet right now because she went into heat, and she did pack on a couple of pounds. She's a little bit over 4 pounds now. Well, she's 4.5. So it's like she gained a whole pound, and she does look a little chubby. So I'm putting her on a diet. She loves to eat. Oh my gosh, she knows when it's breakfast time, and she knows when it's dinner time, and she knows when it's treat time. And she won't let you forget it. She just loves her food, and she is not the type of dog that you can leave food out all day. She would eat it all in one setting. And so she's always hungry. She's probably gonna perk up because she knows what that word is. But she's doing really well, and I haven't been able to walk her as much as what I like to because it's really cold here. It's too dark in the mornings and it's too cold, and in the evenings when I get off from work, sometimes it's too late at night, and I just, it's just tough for me sometimes to get her a walk. I wish there was a dog walker I had in the area that I could trust to walk her. So I'm going to start trying to walk her more in the afternoons when I get off work. Just make a point of just bundling her up and get that done. But I just wanted to give you guys a little look-see at little Miss Misha Boo. I gave her a bath today. So she's all pretty for Christmas tomorrow. And yeah, okay. So about a month ago, I put up a community post, and I also posted in my stories on Instagram for you guys to, send me your device questions. Well, on Instagram, I got a few, and over here, I got a few. I didn't really get very much, which is surprising because I put that up, and I'm still getting device questions. So I'm going to answer those questions. Unfortunately, the one on Instagram, I accidentally deleted it, but I do remember a few, so I'm going to go over those. I'm going to go over some device stuff here as well. So this video is pretty much all about devices, which is what my channel is basically about these days. So first off, I want to make a disclaimer. So yes, some of these devices were sent to me for review, and I am an affiliate with, but all opinions are my own. And when these companies send me these devices for review, I tell them that I have to be able to give my honest opinion about each device that I review. Now, with some of these devices, I do have the affiliate links. So if you use my link or my code, I do make a small commission off that. And that all goes back into the channel with me picking up and purchasing things to review here for you. Now, if you've been following me for a while, you know that I actually use all of these devices, and some of these devices you have seen on my channel ever since it started. And I continually use these devices because they are what I love and my skin loves. Now, when you're first starting out with devices or devices in general, you know, you have to make sure that your skin is healthy. A really good skincare routine, you don't have a lot of inflammation or irritation in your skin. You want that healthy barrier. Now, I will say my skin in the last 7 months, and actually the last 2 months has been so great, okay? I switched up my skincare routine to Osmosis. I'm using the entire Osmosis line. I have been using it for 7 months now, and I did slowly start to add products in. That's why it's also taking a long time for me to do this review, because I have picked up a few more products and I'm testing those out. But also I have issues with reviewing this line because there's somebody out there who likes to attack me every time I talk about Osmosis. But the thing is that the last 2 months, my skin barrier has totally changed. And, you know, Osmosis is all about permanent change. And, you know, sometimes when we use these products, it takes a while for us to see results within our skin. And one thing, you know, that hinders that process for me is my age. I am 45 and a half, almost 46. And so my cellular turnover is a lot slower. I am not someone that exfoliates every day. I only exfoliate 1 or 2 times a week. And that's with an enzyme mask and then dermaplaning or shaving my face. And I don't use a lot of actives on my skin. I don't tolerate retinols. I don't tolerate like certain acids like glycolic on my skin. So I'm not someone who exfoliates all the time, and I'm okay with that, and my skin is okay with that. Now, the one product that I can attest that has been the absolute game changer for me and my skincare routine and the health of my skin, and that's the Osmosis Rescue. So this is their barrier repair serum. This works on the surface of your skin. It has a patented ingredient called trioxylane, which is an oxygenating molecule. So what that does is it helps heal your barrier. It brings that oxygen to the surface of the skin to heal inflammation and irritation in the skin and restore the barrier. So if you have acne, rosacea, you have aging concerns, if you've over exfoliated, Rescue is actually a product that I recommend for everyone, and you can use this with any skincare line that you're currently using. It's just that Rescue is one of those serums that would be the last serum after your actives and your water-based serums, because, well, I'll say your water-based serums because Rescue does contain glycerin, and sometimes glycerin can block those other water-based serums from penetrating the skin. So that's why this is last. It's my last serum in my skincare routine, and I will go over that more so when I do that review. I'm going to stop saying that. So this is the one serum that is a game changer for me. Now, what I have done to test the health of my skin is I've tested certain products that I had issues with in the past. Excuse me, I have to take a sip of water. I still get a little dry from time to time, you know, lingering effects of COVID. So if you guys remember in the past, I developed an allergy to hyaluronic acid, and my barrier wasn't healthy then. I also had perioral dermatitis, and every time I used skincare or conductive gels that had hyaluronic acid in it, I'd break out in a rash. So I had to stop using it. I took a break from it. Well, I have been testing a few things because, as you guys know, I you know, love the Ladura Velv Pro facial wand. Well, they sent with it this watermelon gelato serum to use with the device. Now, when I first tried this serum, I broke out in a rash and it irritated my skin. Well, I recently picked it up and started using it again, and I have no issues with it whatsoever. No irritation, no inflammation or redness in my skin, and I can use it now. And now that I can use it, I do love it with the Velve Pro. So it's been lovely with my treatments. And I also use the Velve Pro right after I use my radio frequency device, the Nebulift, with that gel with the conductive mist from 7E MyoLift. So, and as you notice, I'm, using my devices more consistently every week because I'm no longer getting the rashes from hyaluronic acid. Now, there is hyaluronic acid in Osmosis skincare, and from when I started using Osmosis 7 months ago, I never had any issues with it. No breakouts, no inflammation or irritation. And what I've noticed, the biggest changes in my skin is my redness. I don't get as red anymore. I am still reactive to touch, so if I massage my skin or, apply my products, I do get red. But the overall redness in my skin has completely diminished. Well, not completely, but it has significantly diminished. My broken capillaries are less apparent, and this broken capillary that I have underneath this eye is actually starting to look less apparent. So Osmosis has been amazing for my skin. And this serum is the one serum that I recommend that everyone try. If you're interested in Osmosis, I would start here because you can use it with your current skincare. And then when I do that review, if there's, more of the products that you want to introduce, you can, but there's just certain ingredients or certain skincare products that you can't use with, some of their serums. So I wanted to talk about that. An update. So I know I said I was going to do an empties video a while ago. Well, I keep forgetting to let you guys know that actually when we came back from Greece, our house got infested with ants. So here California in general is in a severe drought. And the last 2 years have been really bad with rain. I mean, we're starting to get some rain now, which is so lovely, but it's been so dry here. And when it gets really dry, the ants come out. They're searching for food and water. And even though it's been raining, they're still coming out. And I still get a few, that I find here and there. But when we came back from Greece, I keep my empties in my bathroom in a bag. That whole bag, everything was infested with ants. So I had to toss them all out. And I apologize for that. So I have been saving my empties from the last month. And so soon I will do an empties video for you guys. Soon I'll do a favorites video for you guys, but that's all I'm going to say because every time I say that I'm going to do a video in a certain amount of time, it never happens because something comes up. All right. So I want to talk to you about some of these devices before I answer your questions. So I want to talk about the Aura Lift because I get a lot of questions about the Aura Lift still. Now, oh, by the way, I got my nails done. Look at how pretty this color is. I don't know if you guys can see it, but when I go outside, it's so sparkly in the sun. It looks like liquid sparkles. It's called Pinky Purple, I believe, by DNC. It's so pretty, huh? All right. So, excuse me, I have a little itch there. So the Aura Lift. Okay. So what I get is, how am I supposed to use this? When you first get your Aura Lift devices, they come, in the solid state. They're not molded yet. So you can't judge it by putting it into your mouth and saying, hey, it's not going to fit my mouth. I'm going to sneeze. I'll be right back. Okay, sorry about that, guys. I had to sneeze. Okay, so you have to mold the devices. You mold both of them at the same time. So you go through the process through the app. You watch a video, they'll show you how to fit the device, okay? And once you get them fitted, you do a tap test, okay? Now, when you first start off with the devices, it's recommended to wear it for 15 minutes twice a day, every third day. Now, after you use the device for 15 minutes, and the whole point of this is you want to keep your top teeth from touching these blocks. And every time you touch it, you record it in the app or on a notepad within that time frame. Now, after you wear this, if you experience any discomfort or pain, they tell you to take a small break from it and possibly reduce your time. So if you're finding that 15 minutes twice a day, every third day, isn't working for you, you're experiencing discomfort, that's when you need to adjust your program from the 15 minutes. So that's when I would jump on a Zoom call with Auralift. Jump on a Zoom call with them if you have issues fitting the device. Jump on a Zoom call if you're wearing it for the recommended, time and you're noticing discomfort. Then you want to jump on the Zoom call and find out what's going on so they can customize the treatment for you. If you have no issues wearing it for 15 minutes, once you can get up to it to where you don't tap these blocks or you tap them like maybe 1 or 2 times, you want to adjust your time from there, and you continually adjust the time to where you can wear this for a full hour twice a day, every third day, without touching these blocks, okay? And once you can do that, that's when you start introducing the pink device, which I don't have here. So you wear this for 55 minutes, and then you pop in the pink device for 5 minutes, and you go from there by adjusting the time, and you're gonna do this over the 4-month period. Now, take into consideration that you may not get into the pink device, which is the larger blocks, okay? It may take time, but when you take your 2 months off and you restart again the same way, you may be able to reintroduce it there. Now, what is the Auralift going to do? It's going to reset your facial structure. It's going to elongate your jaw and reset it to where it was before, so you'll have a more defined face or more defined jawline, defined cheekbones. Eyes will look wider and more open. It helps with your posture. It helps with your overall, the way your face looks. And it helps with facial pain. If you suffer from teeth grinding or TMJ or jaw clenching, it's going to help with that. It has helped with me so much with that. And if you're a teeth clencher, if you're a jaw, if you're a teeth clencher or a teeth grinder, what happens is that those muscles will shorten over time, and it shortens your face, and then you'll start to notice the sagginess in the jawline and everything. So that's what the Auralift is going to do for you. It does help with your skin is wearing, your pores look smaller. It helps with the fine lines and wrinkles, because as your face structure is being reset, your skin will take on a different appearance because it's elongating it, so everything is going to look firmer and tighter, because a lot of times, when our facial structure shortens, the skin looks saggier. When it looks saggier, our pores look larger. So I hope that helps you with those questions. If you have any more questions, please let me know. Next thing I want to address is actually the Maisama serum. So the Maisama green rooibos press serum. So I get a lot of questions about this on how to use it. And I've mentioned this several times, and some people hear it and some people don't, so I'm going to mention it again. The Maisama green rooibos pressed serum does contain oils in it. So when you're using this, you cannot use your microcurrent right after or your radio frequency right after, because it has the oils in it and it will block the current. You have to wash it off. So if this is something that you want to incorporate into your routine with your LED light therapy, you're gonna have to rework your whole device routine like I did. So when I use this, I'll use it first thing in the morning. I wash my face with their cleanser, which I love, their gel balm cleanser. Then I apply the Maisama serum, and you have to wait 15 minutes before you use your LED light device, because that's how long it takes to penetrate into the skin. And the same thing is recommended if you just make your own green tea concentrate from using like the green tea bags and soaking them and applying it onto your skin, soaking your skin with cotton facial rounds, and you leave it on your skin for 15 minutes and then you do your LED light therapy. Same thing with the serum. You have to wait 15 minutes. Now, what I do, wash my face, apply this, wait 15 minutes, apply my LED light therapy with the Aduro, do my 20-minute treatment, and then after I'm done, I apply my eye cream, my face moisturizer, and my SPF because I do it during the day. If I am going to do LED light therapy in the evening and do my other devices, I don't use this because I want to use it, leave it on the skin because it has so many wonderful ingredients in it. It's hydrating, it's nourishing, and it's very good antioxidant protection. So you want to leave this on your skin. If you're just going to wash it off, you're basically wasting it, and you might as well not purchase it. This has made a difference in my skin when I use it with my Aduro LED light mask. I absolutely love it. But however, it may not be for everyone because of where you use your LED light therapy in your device routine. If you use it right before your other devices, then this probably isn't going to be the best choice for you. You might want to look into making your own green tea concentrate, or look, for another green tea product, which there isn't much on the market. So there's an update on the Maisama serum. Now, since we're talking about, well, actually, I'm going to go into fascia. So here is a tool that everyone should have in their skincare arsenal. So I get questions on the Omna all the time, and the one that has come up recently is, can I use it every day? And the answer is yes. You can work your fascia every day if you choose to. You can do a long session, you could do a quick session, you can spot treat, do, whatever you feel like you need, but I say at least 2 to 3 times a week, do a full fascia release all over, and once a week, do those deep fascia holds. Now, I recommend the Omna for everyone because pretty much everyone can use this. Though some that I wouldn't recommend it for is for those of you who have acne or active acne with pustules. You do not want to, massage over that with the Omna or do any like gua sha. You want to do more of a pressure point massage, or you could do the deep fascial holds, because if you break those pustules open, it's going to spread that bacteria all over the skin and will result in you breaking out all over and getting a bacterial infection. If you have fillers, check with your injector to see if it's okay if you can use the Omna on your skin for facial massage. I know usually they say wait 2 weeks because when you do fascia release over fillers or any type of massage, they can migrate into other areas. So make sure you check with your injector to see if it's okay. And the same thing with Botox. I don't see a problem with using this with Botox. It's just that you usually want to wait until 2 weeks after, okay? But always check in with your injector or your physician before you start any device or tool if you have questions on whether it's going to fit into your skincare routine or with procedures that you've had done. Now, I love the Omna. It's the one tool that I recommend for everybody. As you see, I have 2. This is my original Omna. I've had this for years now. And as you can see, it looks a lot different than my pink one here. So the original Omna that came out, it was a little bit larger. And when I very first started to introduce this, I found it was just slightly a little bit too large for my skin. And then this design came out, and that's when I purchased the rose quartz one. Now, I love this because it's multifunctional. You got the spine here, which can be used as a gua sha tool to drain lymphatic fluid. You can use the thumbs here. You can do a nice jaw massage with the thumbs. You can use them for pressure points. And then you have the fingers here, which you can use for your fascia release, okay? You can also use the fingers for a single claw for the smaller areas on your face. Now, I know what you're thinking, why do I have 2? Because I saw that the size had changed, and that's the reason why I got the second one. So this one now I just use for my scalp because I always do a fascia release in my scalp, and the last thing I want to do, because there's oils and product in my scalp sometimes when I do this, is use this on my face. So what I do is this one is for my face, and this one is for my scalp. Now, you don't have to do that. What I would recommend is if you use this on your scalp, if you're going to use it on your face right after, wash it off, and then use it on your face. Now, you don't necessarily have to use oil all the time with your Amna. You can use this over your conductive gel like I do sometimes. I grab a mist it over my conductive gel after I do radio frequency, and then I go in, I'll either spot treat or do a quick surface release. The only time that I use oil with this is if I'm going to do a long session where I'm working everything for like a good 20 to 30 minutes. I work everything, my chest, my shoulders, my neck, and my face and my scalp. That's the time when I use oil. Sometimes too, what I like to do is at night, when I've done my nighttime skincare, I'll use this over my facial moisturizer and just do a quick release. That's what I did last night. And so, yes, so the Amna I recommend for everyone. Now I do have other fascia release tools for the face here that I have demoed in the past. So I have the Face Blaster. So the Face Blaster, I like it, but I don't really recommend it for anyone anymore because the Face Blaster, it's nice, it's shaped. I love the smaller claws, but it can encourage you to dig into the skin. When you are releasing fascia, you do not want to dig in the skin. It's a light, brisk movement, like at a 1, where you're not pressing into the skin. You're doing this at the surface level. One of the other things I don't like about the Fascia Blaster is that it's cheap. If you drop it, it will break. These claws will break. And I've been through like 5 of these. This one my husband glued back together, and I'll use this on my body sometimes, but I don't use this on my face anymore. I use the Amna. Now, I introduced you guys to the OMG Blaster. I think it was like last year when this came out. It was a set of 5 different tools, and this is detachable. You can interchange it. So out of that kit, this is the one that I like. I like to use this around my lips, around my chin, around my eyes, and around my nose, and in between my brows. This is really nice, but you can use the 1 finger of the Amna for that too. This is really expensive for what it is. They do sell this separately now, but it's $100. It's $100. Why? If I was to drop this on the ground right now, it would break. I just don't get it. I mean, it's just these Fascia Blasters are overpriced. I love them, what they do for the body. I love the body tools, but this is $65. This is $100. So I don't really demo, you know, these, the OMG on the channel because I don't really like it. The only one that I like is this one. Now, I don't think you need to necessarily go run out and spend $100 on this, because if you have the Amna, you are complete because you can use just 1 finger. Okay. All right. So that's it on fascia. Now let's go into LED light therapy. Now, I want to talk about LED light therapy really quick. I do have 2 new devices that I'm going to share with you guys. So LED light therapy. So you have so many choices for it, and Aduro are my favorite devices. Here's the neck piece, and then I have my 7-in-1. And the reason why I want to talk about LED light therapy really quick is because I have been getting a bunch of you reaching out to me, especially after I've done my last few videos, who have the Omnilux and the Current Body, saying, yes, it's making my pigmentation worse, okay? So, Current Body and Omnilux and Light Salon and higher dose. It's red LED light therapy and near infrared. The light that's causing your hyperpigmentation and your melasma to get worse is near infrared. And the reason being is it does reach deeper down into the skin, but there's heat involved in that. And if you have hyperpigmentation, if you have melasma, I say avoid near infrared and possibly infrared too. I don't see it as much with infrared, but I am seeing it and hearing it a lot with near infrared. Now, one thing that you can do to help mitigate this is you can hold the device about 6 inches away from the skin. but that doesn't always work all the time. Uh-oh, someone's at my door. I'll be right back. Well, that doorbell was for me. I got a huge PR package from Medicube. Now, a lot of you have reached out to me to ask me about the Age R device, and I have it here. They also sent this Age R Booster H device, which I'm like actually really surprised about that. And they sent me a bunch of skincare to try. Now, I've checked out their skincare and it actually looks really good. Let me put this down. Misha's freaking out over here. It actually looks pretty good and it's not that expensive. So I have some skincare in there and I have 2 new devices from Medicube that I'm going to try. Now, you guys know I'm not a fan of electrical muscle stimulation or EMS, but however, that Age R Derma EMS shot looks pretty interesting, and I've been hearing a lot of people talk about this and saying wonderful things about it. So I want to give it a try and test it on my skin for you guys. I've been noticing people getting a lot of, really nice jawlines from this, like Darcy from the Brazilian Girl channel. She really loves this device. And it's interesting that they compare this to like esthetician fingers on your face. So look forward to that. That's one of the new devices that I was going to introduce to you guys to the channel, but I actually wasn't expecting this because they said, excuse me, I keep getting dry. They said that there was going to be a delay on this because the Age R EMS shot device was actually out of stock. And they sent more skincare than I could have imagined, which I'm super excited about to share that with you guys. So I cannot wait to get into those. And I will be testing the moisturizers that they sent right away because I am getting low on my Osmosis moisturizers. And I'm not going to be able to place that order for a while because when I place my Osmosis orders, it's, I have a professional account with them. The shipping is very expensive, so I like to wait to have more items to justify the shipping cost. And yeah, okay, so let's get back into red LED light therapy or LED light therapy. So if you have hyperpigmentation, melasma, I would recommend that you stay away from devices that have near infrared. Now, I hear some people say, well, I have hyperpigmentation or melasma and it hasn't, caused any issues with my skin. But I am getting so many people, reaching out to me and telling me that they have noticed more dark spots showing up. Their spots have gotten worse. And my advice to you is to stay away from near infrared. It's stronger than infrared and it creates more heat under the skin, which heat is a trigger for hyperpigmentation and melasma. That's why I always say use radio frequency with caution, because those of you who have hyperpigmentation and melasma, yes, radio frequency will cause those spots to get worse or bring up new spots. I notice it more so with devices like the NUA. That's why NUA recommends if you do have hyperpigmentation, melasma, or you have darker skin tones, not to use that device. Now with the Nebulift, I'm not so sure because it gets warm, but it's not that warm. But I still say use with caution. Now, LED light therapy, red LED light therapy helps with skin density. It's wound healing. It helps with inflammation and calming the skin down. It helps with your skin appearance and tone. It's also excellent for those of you who suffer from eczema. If you have eczema, use your red LED light therapy on your eczema. I'm using it on mine and it just freaking is amazing. I wish I would have thought of that sooner. I don't know what I was thinking. I was having a moment. But use it on your eczema. It's amazing for your eczema. Now, the LED device of choice for me, if you're looking for a mask, and this is my favorite LED device of all time. It's the Aduro 7-in-1 silicone mask. I love the silicone mask. I love LED light masks because they're freeing. You can still do things because this is a 20-minute treatment. And, you know, sometimes we don't have 20 minutes to sit back. We need to walk around the house and do things in order to get our treatment in, right? And that's why I love these masks. Now, I find that the Aduro is effective for my skin. And those of you who've picked this up on my recommendation all love it, I know. Now, I love this out of all the silicone masks is because I think it's the one that is the nicest quality. It's very, very nice quality. Mine's over 2 years old now. I'll turn on, it's going to be on blue light. You can see all the different color lights here. I love skin booster mode, which is red LED and infrared. So what I love about this mask is, you know, all the different lights. And if you have hyperpigmentation or melasma, you can just use red LED light with the Aduro. There's also red and infrared function as well, but you have the option for blue LED light. With the other silicone masks out there, there's just one function, red and near infrared, and it's still almost $400. So, you know, take that into consideration when you're looking for an LED device. Now, in my last video, I told you guys I was looking into getting the Qure. Well, I was in talks with Qure, and they're actually not sending this out to creators at the moment. Well, I've seen that they have, but they're creators with a bigger following than what I have. I am like small beans compared to the creators that they're sending this out to. So what they did is they gave me a discount on the Qure, and I purchased it. This device I absolutely love. Now, this is a hard shell LED light mask. I'm going to show you what it looks like. Here it is. It's really beautifully designed. I absolutely love it. Now, this is a hard plastic on the outside, and then it's silicone on the inside, and you do have like a silicone pad here. And I find that it's really comfortable. Now, I have been demonstrating this on Instagram because the last few weeks I've been doing reels, short content, because that's what I had time for. And I haven't uploaded them here to YouTube, which I should. It's just like, I'm not really a fan of shorts on YouTube. I prefer, you know, long form content on YouTube versus shorts. That's what Instagram and TikTok are for, is short form content, in my opinion. So this mask, I love it. It's a 3-minute treatment. You have 2 modes. You have anti-aging, which is red LED, deep red LED, amber LED, and infrared. And then you have anti-breakout mode, which is blue LED light. Now, for those of you who have hyperpigmentation and melasma, you use blue light with caution because blue light works more in the surface, and it can aggravate your pigmentation. I've been hearing this come up a lot lately, but nobody's reached out to me about that because they're seeing it more so with the near and red infrared mask. Now, so let's play with this really quick, shall we? I have to say the quality of this device is so nice. It's better than what I thought it was going to be. Now, for me, personally, I've gotten the question with using this is, do I prefer this or the Aduro? I prefer the Aduro. The reason why I picked this up is because it's a 3-minute treatment and it's a mask. You know, I really want to pick up a light stem for wrinkles, and I probably will because I think that it would be great for spot treatments. But my preferred way to perform my LED light treatments is a mask because, you know, if you're sitting there, you don't have to, you know, move the handheld, you know, in all these different spots, which would take, you know, 25 minutes, and you usually, you know, have to have them plugged into the wall. The mask you can walk around and be free in. So when you use this, you can use it with an app to customize your treatment, or you can simply just press the power button here. So I'm gonna press the power button, it's on, and then I'm gonna press it again, and it's gonna go into anti-aging mode, which is the 4 different lights. And you can actually see the 4 different lights in here. We can't see infrared, it's, you know, colorless, but you can see the 3 different lights. There's red, deep red, and amber in here, okay? Then you switch it, you press toggle it again, and it will go to blue light. And the blue light actually looks purple to me, but it is blue light because when I put it in certain angles, it looks blue, and other angles, it looks purple. So there it is. Now let's do a customized treatment really quick with this. So I love this because this is a 3-minute treatment, and this was my go-to LED device for my face this week because I was so busy. I didn't have time to do my Aduro, and I just threw this on really quick before I did my Nebulift treatment and my microcurrent, and it was great. Now, when I use the Qure, I do not use it with my Mysama serum. I use it on bare skin because it's only a 3-minute treatment. And when I use this, I'm going to use this right before I do my other devices. So I picked this up so I could have a quick LED light treatment for when I'm on a time crunch, and I can use it right before my devices. All right, so I'm going into the app. I'll post the app in here, and I'm going to connect the device. And I'm going to customize a treatment. So you can customize this treatment, which you could probably see on the screen there, hopefully. Okay, so now that I have my treatment customized, I turned it on. And so what you can do for the customized treatment is you see right here on the outside, it's red LED, and down the center of the face, it's blue LED. So in these different areas, you have the forehead, the temples, the cheeks, the nose, and the chin area. Those are all separate areas that you could choose which color that you would like to treat in those areas. So if you have, you know, certain areas that you're concerned with breakouts, you could use blue light, and then at the same time treat the areas with your aging concerns with red LED light therapy. So cool, right? So how you customize this is through the app. Now, I know there's a lot of you who are anti-apps when it comes to devices. And, you know, I have to tell you that going forward, apps are the new future with devices. As you see, all these devices are coming out app-based or have an app companion like the Qure. That's just the way the technology is going now. And I just wanted to, you know, put that out there. And you can use this without the app for just simply red LED or blue LED. Now, I've been using this for a week now, and I have to tell you, I absolutely love it. I'm so happy that I picked it up, and I will do a full review very soon. But, you know, down from the quality of the mask and their beautiful packaging. So it comes in this beautiful case, and you have this drawer that slides out here, that you have a manual, a carrying case in here as well. So here's a carrying case, here's the manual, and then here's your power cord. It is USB. It charges through USB, so it doesn't come with a plug. It comes with a cord that you can plug into a wall outlet or a USB charger of your choice. So the packaging is really nice. It doubles as a case for the mask, just like that. So I'm really happy with this device so far. As of results, I can't give you any feedback on that because I've only been using it since Friday, so 1 week. I love it. Now, my other LED device I wanted to give you guys an update on is the Current Body Lip Perfector. So I have been using this every day now for 3 weeks, and I'm noticing some changes with my lips. I'm not noticing any plumping whatsoever. What I'm noticing is the skin texture changing. When my lips are chapped, it does help soothe them and heal them. But the skin on my lips is actually looking a little bit smoother. And it's still early to tell because it has only been 3 weeks. I do love this device. However, I will tell you, and I still feel this way, is I wish I would have picked up the light stem instead because I can use it for spot trading. However, I have made this multifunctional. I take off the mouthpiece, and if what I do is when I'm going to treat my eyes, I close my eyes and I hold this over each eye for 3 minutes to spot treat my eyes. So not only do I use it around my lips, but sometimes I use it to spot treat my eye area if I don't want to do a full mask treatment with LED light therapy. So I do like it. I just think it's a little bit pricey for what it is. I mean, it's $181. Sort of gimmicky in my opinion. Nice quality. But that's all I can really say right now. Yeah, I'm kind of thinking, yeah, why did I pick this up? But it's my honest opinion. So, and I purchased that on my own. All right. Okay, so let's talk about microcurrent really quick. So y'all know my favorite microcurrent devices are the MyoLift devices. I love my MyoLift devices. I just love them so much. They have been my favorite for 3 years. I don't see any turning back. They just do it all for me. Now, the Mini is my personal favorite. I love the QT, which I thought I brought in here, but I guess I didn't. I love the QT for like when I want a quick treatment, really quick, or to spot treat, you know, like my eyes or my lips. You know, it's a great travel device too. Now, microcurrent, what it does is it helps stimulate ATP, which in turn helps with wound healing. It helps, you know, get the cells energized to build that collagen and elastin. And this happens with true microcurrent. So microcurrent does not build muscle, it lifts and tones to define your facial contours, and which in turn helps pick up the skin too to help it look firmer and tighter. Now with the MyoLift devices, one of the main reasons why I love them is the 2 waveforms, stretch and erase. Erase and stretch. Stretch on the QT, erase on the Mini. This waveform, no other device out there has it. It helps with fine lines and wrinkles because it helps release tension in the muscles. So it lengthens the muscle to relieve tension, which helps with those dynamic wrinkles that are formed from repetitive facial movements that we get on our forehead, in between our brows, crow's feet, smile lines, and lip lines. However, you can use erase mode. You can use it on your neck to help with any kind of tension that you have in your neck. You can use it all over if you wanted to with the gloves. Now, it's one of the reasons that, it's one of the main reasons that, or one of the main things that sets MyoLift apart from the other devices out there in the market. The other is that they actually use true microcurrent, which is questionable from other devices because they don't say which waveform they use. Also, you can see that you're actually conducting into the skin. And there is something that I heard recently from, you know, over here on YouTube from a content creator. They were promoting the zip, of course, but they were saying that they find that when they use the MyoLift microcurrent devices, that it dries out their skin. Now, I've never experienced that with my skin, and I've been using MyoLift devices for over 3 years now, and I just thought that was pretty cheesy because they're promoting the zip because they're getting commission for that now. But the only way that microcurrent would dry out your skin is what you're using with it. Your conductive gel, that matters. It could be something in that conductive gel that's irritating or drying out your skin. Are you using serums underneath that conductive gel? Maybe it's interacting with the conductive gel that you're using and causing your skin to get dry and dehydrated. But microcurrent does not dry out your skin. Now, another thing with these MyoLift devices is that you have control over the intensity and you can actually see if they're conducting. And that is so important with your microcurrent treatment because everybody thinks stronger is better. Well, it's not. Stronger is not better with microcurrent. If you're getting that muscle twitching, it depletes your ATP. We do not want to deplete our ATP. We want to increase it and build it, right? Well, muscle twitching also stresses the skin out as well, because that means the current is too strong and it's going through the skin. So stronger isn't always better for microcurrent, and I wanted to put that out there. And also, what happens with muscle twitching, sorry, I had a little brain fart there. Another reason why muscle twitching isn't good is because it does deplete the ATP, right? But when you get the muscle twitching, it means the current is too strong. Muscle can't handle it. And you'll get a lift, but it's not going to last very long. You'll be lucky if it lasts 12 hours, okay? So we don't want muscle twitching. We don't want too strong of a current. You stay within the parameters. When you're starting out with your MyoLift devices, you know, there's level 1 erase, level 2 erase, level 2 educate, and level 1 educate. If you get the chart out, it tells you what areas to use what level. Now on the forehead, we always use level 1 erase and level 1 educate. Underneath your eyes, you cannot use level 2 erase or level 2 educate, because underneath the eye area is very sensitive. It's a delicate area, and you should not go over 300 microamps in the under eye area. However, you can on your brow and in between your brows for the 11s. And your cheek area, your jawline, you can use level 2. Neck is always level 1. The neck muscles, if you use too strong of a current in this area, the muscles will not respond. And that's the reason why 7E recommends using level 1 educate and level 1 erase. So, and they explain this in so many videos, and they have it in the muscle chart that you get, the diagram in your manual. It's all in there, and I just wanted to throw that out there. And just always remember, stronger isn't always better. Okay, so now I already talked about radio frequency a bit, but you know, radio frequency, what it does is it works in the skin to help firm and tighten. It smooths your skin texture, and it helps build collagen, okay? Now, my two favorite devices are the Nebulift and the Nua. If you have sensitive skin, I recommend the Nebulift because it's gentler on the skin versus the Nua. The Nua, if you don't have sensitive skin, your skin, you know, doesn't react to a lot of ingredients, doesn't react to heat, go for the Nua. Now, everyone can use this. I prefer the Nebulift not only because my skin receives the treatment better without the inflammation and dryness that's associated from the heat, but I just enjoy this treatment more so because it's 2 minutes per section. It's a quicker treatment versus the Nua. It's 4 minutes per a section, and you can be there for about 24 minutes performing your treatment. The Nebulift is recommended that you use it daily, where the Nua, it's a shorter time frame. So when you first get the Nua, you use it 5 days a week, you know, for your full treatment. Then you go into a maintenance phase of using it like 3 to 4 days a week. The Nebulift, they always recommend that you use it daily. Now, with the Nebulift, I see more results in my skin versus what I did with the Nua, and the reason being is that the Nua was causing a lot of inflammation in my skin, and so my skin couldn't focus on building that collagen and elastin. It was focused on, you know, restoring my barrier from the inflammation it caused. And Nua does, you know, caution those who have sensitive skin. They actually recommend that you do not use it. However, some of us don't listen, and I had to test it for you guys. Now, I did get great results from the Nua, but it just caused too much inflammation and dryness in my skin, where I don't get that with the Nebulift. So the Nebulift is my radio frequency device of choice. And then I also recommend the Nua. Now with the Nua, I would just say, like I've mentioned before, if you have hyperpigmentation, melasma, or the darker skin tones, it's not recommended for you. And that's where you might want to look into the Nebulift to see if it's right for you. They say all skin types can use it, but I say if you are prone to hyperpigmentation, melasma, use with caution and at your own free will. All right, so that is pretty much it for my devices. MyoLift is having a sale for its 2 more days, 48 hours, 15% off site-wide. Ladura is having a sale too. Buy one, get one 50% off site-wide. These are like 2 of my favorite devices for 2022. I love the Valve Facial Pro Wand for when I want a quick treatment. Like this week, this was my best friend because I didn't have a lot of time to do my devices. I didn't have time to really do any microcurrent on my skin. This was my device of choice this week, along with my Nebulift. And of course, I love my Duo with the Boost Pods. The Boost Pods are amazing. They're my favorite. I just love this device. I don't know if if you saw me on Instagram, you notice I'm getting like all these new hairs popping up here. See, look, all this new hair growth is going in and my hair loss has finally stopped. I'm not losing any more hair from COVID. So yeah, let's go into those device questions now. All right. So I have a couple here that I wanted to answer. So one of the questions that I received on Instagram what I answered was that, can you use the Omna every day to do fascia release? And the answer is yes, you can. Now, let me go to this post. All right. So a question that was asked is benefits and differences between LED and radio frequency, and what are the available models? Well, I already went over the available models. The difference is radio frequency works in the skin to firm and tighten the skin. So it helps with sagging skin, it helps with fine lines and wrinkles. Where your LED light therapy, they're 2 different devices, 2 different modalities. You can't really compare them. LED light therapy helps build the density back into the skin. It helps with your overall texture and tone. It helps reduce the look of fine lines and wrinkles because it is building collagen, but it's also wound healing. It stimulates ATP, and it also helps reduce inflammation in the skin. So I hope that helps you. Second one is down to the bare minimum, microcurrent or radio frequency. Which one, also out of LED, radio frequency, and microcurrent, which one helps with crepey neck skin the most? So down to the bare minimum, I would choose microcurrent because microcurrent, is going to lift and tone the muscles where radio frequency just tightens the skin. So you can get some skin tightening from lifting and toning the muscles. Microcurrent will help open up your eyes and define your facial contours, where radio frequency doesn't really do that as much. So my choice would be microcurrent. Also, pretty much everyone can use microcurrent unless you have a pacemaker, but always check with your healthcare provider just to make sure that you can use these devices. Out of LED, RF, and microcurrent, which one helps with crepey neck skin? So I would suggest, so microcurrent isn't going to help with your crepey neck skin. Usually crepey neck skin is because you need to release tension there. So I would actually suggest that you work the fascia in your neck and use, so this area right here, you cannot use microcurrent, and I say use radio frequency with caution. You should avoid your thyroid, but you can use underneath your chin. You can use LED light therapy in this, and it will help with crepey skin along with releasing that fascia, but all of them will help relieve crepey skin in some way or form. It just depends on what you have. You can make it work. Also, crepey skin is lack of hydration in the skin, so make sure you're hydrating from the inside out, and taking your skincare down to your neck and chest. I always recommend that you take your skincare all the way down to, from your face down to what they say, your nipples. So, all right, so I got this one. I would love a designated monthly schedule to do what, when, and the order of the devices. Also, the best gels and ways to utilize gels or masks. So with the designated monthly schedule, that's kind of tough because I don't know what devices you guys have. I don't know your skin. So Penn Smith did a great job and she put out a schedule. It's even in her blog. So she did do that, but each device has a set instructions on when and how frequently to use it. So I can't really give you a set schedule because I don't know your skin. I don't know what devices you have. I can just do something like what I do and show you guys, but device routines need to be customized. So I would suggest booking a skin consultation and getting a designated device routine that's designed for your skin and the devices that you have in your arsenal. And then also best gels and ways to utilize gels or masks. Excuse me. So that's going to be a separate video. I use my Nebulift gel the most because I do my Nebulift treatment pretty much every day, except for Sundays. I don't do any devices unless I skipped a day during the week. So usually what I do with this, if I'm going to do a spot treatment with microcurrent right after radio frequency or use the Ladura Velv Pro, I leave the Nebulift gel on my skin and I just go in with the 7E Replenish Mist. This is a conductive mist. If I'm going to do a full MyoLift mini treatment, I just apply my Restore Conductive Gel in sections. And I just apply this straight over the Nebulift gel. And I love it because this Nebulift organic botanical gel is very soothing and very hydrating on the skin. It does contain lavender, that's it, lavender oil, I believe. Lavender extract. And so for those of you who are sensitive to lavender, this won't be the right gel for you, but it's been wonderful for my skin. I absolutely love it. Nebulift is actually having their Christmas sale right now too. So the gels are 30% off. The R1 is $100 off, I believe, or maybe it's $200 off, but it's the same sale that they always have. I just can't remember at the top of my head. And Walmart.com is now carrying the Nebulift gels, and they're like, I think this one is $59, which is a great deal. So if you use the Nebulift gel, check out Walmart.com. I know I'm gonna go check it out because I need some more gel. So I'll do a separate video on that, and just like like I said, with your a customized plan with your device routine or the monthly schedule. I don't know what devices you have. I don't know your skin. That is just something that should be truly personalized, in my opinion. All right. So, hi Jen, I bought the MyoLift and followed your demo. I love the result. Now the Nebulift is on my wish list. Do you think it's okay to use radio frequency around the mouth and under the eyes? I want to get plump on this area, but someone said it can cause loss of fat. Is this true? So the Nebulift and the NUA and the tripolar devices do not cause fat loss in the face. They do not heat up hot enough to reach that layer of the tissue to melt the fat. But you do not use radio frequency around your eyes, and you can use it around your mouth. I do. No issues with using it around the mouth. You just want to avoid the eye area. Now I know tripolar, it hasn't been released here in the US, but in the UK, they do have a new device that's radio frequency that you can use on your eye area. And I would say use that with caution because I don't know what the temperature is of that yet, but it's kind of scary. I would advise against using radio frequency under the eyes. I know the other devices, you cannot use it because the tissue here is thinner and it will cause some issues, especially with the fat pads underneath that area. If you're looking for, for the fine lines and wrinkles, and, to help with tightening the skin around the eyes, I personally love my MyoLift microcurrent devices for that, and LED light therapy. And there's the Nira skin laser. Now I tried the Nira on my skin, and unfortunately it didn't work out for me. It just caused too much inflammation in my skin. However, there is quite a few people who have seen great results and really love it. It's just not something for me. So, all right, so that's all the questions that I have. As you see, there wasn't very many. I tried, but nobody wanted to play along. So, I have another new device that I want to introduce you guys to. But before I do that, I have a device on my wish list, and I don't know if you guys follow along with Artist Skincare. I love Artist Skincare. I love Gina. She has beautiful skin, and she shares so much of her knowledge with everybody and helps you achieve your best skin. So, Artist Skincare and 7E Wellness, the makers of the MyoLift devices, they collaborated together, and they came out with a new microcurrent device. It's called the MyoLift TriWave. I'll pop a picture here. Now, this looks exactly like the MyoLift Mini. It has Educate and it has Erase, so those are the same functions on it, but it has something different that sets it apart from the MyoLift Mini, which is called Rejuve. So it's a different waveform that helps stimulate movement of lymph to cleanse and nourish the skin and, detox it. Sounds amazing. Now, the device is $795. It's quite a big jump from the MyoLift Mini, because the MyoLift Mini is under $400. Now, this Rejuve wave actually kind of reminds me of the MyoLift MD, which is a big professional microcurrent unit. It has all these different waveforms in it, and I know that they have a wave in there that helps, detox the skin and, stimulate lymph to move it out. So, but that is like, I think the MyoLift MD is like, I think it's over 7,000, and it's for professional use only, where the MyoLift TriWave is actually available to everyone, not just professionals. So another thing that's on my wish list is the Jane Man Lift. I have been wanting this forever, but it is like $400. And I just, I don't know. I want it. So Artist Skincare is going to be carrying the Jane Man Lift. It looks like the Omna, but you use it to perform your microcurrent. They're going to be carrying it, and it's going to be calibrated to use with your MyoLift Mini or their new MyoLift Rejuve or the MyoLift TriWave. So I just wanted to put that out there. Now, these are the two that are on my wish list. Now, I don't know when I'm going to be able to pick them up, because it's going to cost over $1,000 for these two, the Jane Man Lift and then the MyoLift TriWave. I can't think. So right now, you can pre-order the MyoLift TriWave on Artist Skin's website, and it will be delivered before the end of January. Now, at the end of January, it will be on 7E's website to where you can purchase too. But however, the thing with this new TriWave is no affiliate code will work. There will be no discounts given on the MyoLift TriWave. So I wanted to put that out there. So if you see it on 7E's Wellness's website and you want to use my discount code, it will be invalid, okay? So you will not be able to get a discount on this device, but sounds amazing. Gina's going to be doing some content around this, and I can't wait to see the content that she brings about this. And I can't wait to see that Rejuve waveform in action. Now, here is a device that I was on the fence about, and I was just thought like this was a gimmick device, okay? So I'm going to introduce you guys to the Droplet. So I'm going to pull it out of the box here. So the Droplet is a micro infuser that creates microscopic droplets from their formulated capsules that expels them at a high velocity, allowing the ultra concentrated active ingredients to infuse deeper into the skin, not just on top of it, okay? So I wasn't so sure about the droplet. Now, what piqued my interest about the droplet is that they came out with their lip plumper, the 17-volt lip plumper, okay? So my friend Darcy loves the droplet, okay? Darcy from the Brazilian Girl Channel. And I was talking to her about it, and she was like, you know, I really love the droplet. I love their collagen capsule, and I love the new lip filler. And she has nothing but good things to say about the droplet. And I was like, okay, because I was on the fence about it. I was like, I don't know if I, you know, want to get into this because, you know, it's not just a one-time cost. In order to use the droplet, you have to invest in these capsules, which you get by a subscription. Now, the only capsules that they sell, you know, separately are the lip plumper, but everything else is by a subscription. However, you can modify the subscription. So, you know, if your shipment is coming up and you don't need it, you can skip it. However, sometimes we forget about that and it doesn't, you know, always work out to our best benefit. That's why I don't really like subscriptions that much, but however, we'll see how it works out. So I reached out to Droplet and they sent this to me. I received it this week and I have been testing it. I absolutely love it as a first impression. Now, I have used this for 4 days in a row, and I've been using their 17-volt lip plumper and their collagen hydro filler capsule. I love both of these. I love them. Now, I've used this, you know, both of them 4 days in a row. I've used it during the day. It has plumped up my lips so beautifully to what I was looking for. Now, you know, of course it's temporary, but it lasts all day long. And even into the next day, my lips still look nice and plump. Now you focus the treatment on your lips. I tried to film demos today and it just didn't work out for me. So I apologize for that. So you focus the treatment on your vermilion border and on your lip. You do the top half of your lip for 15 seconds and then you do the bottom lip for 15 seconds. And then within a few minutes after your treatment, they just plump up really nicely. And I don't know if you can tell, but my lips look a lot plumper. They're naturally plump. They don't look like they're over plumped. And this is exactly what I was looking for. So I am over the moon happy. Now, these, I believe if you purchase, what is it? I think there's 12 of them that come in here. 2, 4, 6, 8, 10, 12, 14. So 14 capsules. So you can get one of these, I believe is, I don't know the price. I'll have to look it up. You could purchase this separately or you can get it on subscription with 2 boxes every 4 weeks. And of course you can modify that. This is something that I want to continue to use because I love my results. Now, these do not have a scent to them. They have really good ingredients in it. It's collagen, hyaluronic acid, peptides. There is no scent. I haven't had any irritation or inflammation around my skin or my lips from using this. Love it. It's so quick too. The next one is the collagen hydra filler. Now, collagen, there's some misconceptions about it. Like people think that because collagen is in skincare that it's going to, you know, help build collagen. But however, it doesn't work that way because the collagen molecule is actually pretty big. And it doesn't, you know, go into the skin, into an area and make a difference in building your collagen. What is lovely about collagen is that it is an awesome hydrator. It's actually really underrated. So collagen is great for hydration and plumping the skin. I would, you know, I wouldn't, you know, think of it as it's going to build collagen. It's for plumping and hydration. So collagen and glycerin are 2 of my favorite skin hydrators along with polysaccharides. So this not only has collagen in it, but I believe there's vitamin C, there's peptides like arginine. I can't really read it right now, but when I use this, my skin looks so good. I used it today. I did not use a makeup primer for my foundation. It gave my skin a really nice glow. It looks really nice and plump. My lines are real all plumped up. My skin looks a lot plumper and juicier. Oh my God, as a first impression, oh, I love it. I love it. I love it. I love it. I have never tried a hydrating product that has plumped up my skin this much and it's lasted all day and all night, okay? That's how much I love it. Now, I will be signing up for a subscription for both of these capsules. They gave me these to try along with the device. And, you know, I will be signing up for these because I'm almost done with these. And I'm kind of thinking like, oh my God, like I need to go get some soon. I need to go on my subscription soon because I'm going to run out. And I love that the way my makeup looks with this. I love the way my skin looks with this. It just, everything looks so good. Now, I only use this once a day. I use it in the morning. So what I do is after I wash my face, as soon as it's, you know, dry, or not dry, but you know, it's not like soaking wet, I go in with the droplet and I do the full 1 minute treatment with the collagen hydro filler. And then I go in with the 17-volt lip plumper. And then I follow through with the rest of my skincare. And so far I haven't had any reactions, breakouts, or anything like that with my skin. And I've just been loving the results that I'm seeing so far. Now this is, you know, too early to really tell, but as a first impression, I absolutely love it. I will tell you with the collagen hydro filler, there is rose oil in here. And I've heard some people say it's really strong, but to me, it's actually very light. So if you're not a fan of rose oil or the scent of rose, you will not like this. Now, what's really cool about Droplet too is when you get your capsules, they send you this bag so you can send them back to them to recycle. And here's all my empties right here. So I have a handful of them. So this is what the capsules look like. And here it is empty. So they'll recycle these. Now, they don't give you any sort of special discount or send you capsules for free with this currently, but you don't have to pay for the shipping. They pay for it. So it makes it easy for you guys to, or makes it easy for us. So I will do a full video on this soon. I just wanted to let you guys know that I am testing it and so far I'm loving it. Now, another capsule that I'm interested in is their growth factor capsules. If you guys watched Penn Smith's video where she was interviewing the founders of the Droplet and they were talking about their growth factors, they sound amazing. So the other capsules, the glycolic acid, the retinol, and the tranexamic acid, I will stay away from because I can't use those on my skin. My skin doesn't do well with retinol or glycolic. Now, the tranexamic acid, we'll see. I may try it, but the collagen and the lip plumper, I love so far. And I will continue to test this and give you my, you know, thoughts and as the process goes along with the Droplet. Now, if you purchase the Droplet or make a purchase on their website, whether it be capsules or the device, so the device right now is 25% off. And if you make a purchase on their website, you will be entered to win a pack of their growth factor capsules. And that's with any purchase until the end of the year. So I wanted to introduce this to you guys to let you guys know that I am testing it. And as a first impression, I absolutely love it. Now, this you know, device is something that is always going to be a constant investment, and the capsules aren't cheap. So, you know, because I love it, you might not like it. So please do your research to make sure it's right for you, and just know that it is going to be a constant investment for you. So I would only recommend picking this up if you feel like it's right for you. And I can tell you, as a first impression, I am loving it so far. And it's only been 4 days, okay? So take that into consideration. You know, don't run out and buy it right away unless it resonates with you, okay? All right, everyone. I hope you enjoyed this video. It was actually longer than I wanted it to be, but oh well, it is what it is. You got to spend Christmas Eve with me. Now, I'm gonna try to get a video out next week, but I have to tell you, my main focus for next week is putting my goals into place. I need to focus on my health. I'm going back, I need to focus on my eating and getting my workouts in and getting on a regimen. So that is going to be my focus next week. If I can get a video out, I definitely will, but I'm not going to make any promises. But I wanted to wish you all a very Merry Christmas, Happy Holidays, and if I don't see you, Happy New Year! I love you all so much, and I'm sending you and your families all so much love and light, and thank you for all your love and support that you show me and the channel here. I appreciate it more than you know, and I just love you all so much, and thank you for everything. Mwah, mwah, mwah. I'll see you soon. Bye.
Hey now, take a step outside and seize the day.